And it's my pleasure to welcome everyone to today's program. My name is Bonnie Green, and I work with the North Central Texas Area Agency on Aging. And for those of you who are not familiar with our agency, we provide services to older adults and family caregivers with funding from both the federal and state government. As part of our work, we conduct training programs for lay people and professionals on various elder care topics, partnering with experts in the community. And to that end, I'd like to give a shout out to James L. West Center for Dementia Care, which has partnered with us on several training programs. It has a unique commitment to community education and always finds a way to say yes when we ask for its help in doing a training program like today's. This morning, we're going to be talking about handling the stress of having a family member in a long-term care facility that you can't visit because of COVID-19 related restrictions. This is a critical issue that affects us professionally, as our long-term care ombudsmen have been responding to sometimes frantic phone calls from family members and just listening to their fears and concerns. It's also affected us on a personal level as well. Our ombudsmen in particular have had to make huge adjustments in the way they do their work. And I think they feel a really big sense of loss as they've had to stop their facility visits. This morning, we have 3 speakers who will discuss how to cope and provide the latest guidance on current facility restrictions. They are Jamie Cobb and Holly Glover of the James L. West Center for Dementia Care and Tina Ryder of the North Central Texas Long-Term Care Ombudsman Program. And let me tell you a little bit about each of our 3 presenters. Jamie will lead us off. Jamie Cobb is Vice President of Caregiver and Community Education at James L. West. Prior to her current position, she served as Outreach and Education Assistant at the Alzheimer's Family Services Center. She has a bachelor's degree in Marketing Communications and is certified as an Alzheimer's education as well as a senior advisor. Holly Glover is a licensed professional counselor and Director of Education and Family Support Services at James L. West. She facilitates the center's family support groups and is involved in several education services provided by the center. She is a dementia care specialist, has over 27 years of experience. She holds degrees from Southwestern Oklahoma State University, Sam Houston State University, and Dallas Baptist University. Apart from work, she's married, has 1 daughter who is following in her footsteps. Our daughter Joanna graduated from the University of Texas at Arlington in May of last year, with a bachelor's degree in social work and is specializing in hospice care. And last but certainly not least is Tina Ryder. Tina has been the managing local ombudsman for the North Central Texas Council of Governments for 23 years. And she just irritates me to no end because she perpetually looks like she's about 25. I don't know how she does it. Tina received a bachelor's degree in gerontology from the University of North Texas. She is a licensed social worker, and prior to her current position, she spent 10 years working in long-term care. Apart from work, she advocates for young adults on the autism spectrum and is a master gardener. Just a quick housekeeping remark to provide us the best sound quality this morning. All participants will be muted. However, you will have an opportunity to submit questions through the chat feature of Zoom, and we will do our very best to monitor those questions and respond during the program this morning as our schedule allows. So without further ado, let me turn the program over to Jamie Cobb.
Thank you, Donnie. And we really appreciate working with the North Texas Area Agency on Aging, and that you are quick to respond and help us. I mean, we all have the same mission, I believe, educating. And thank you so much for your partnerships and going forward. Just really quick about the James L. West Center. We are a nonprofit long-term care community, but we only serve people with a dementia diagnosis. We are located close to downtown Fort Worth, and we have our residential care and our respite care. We do have a day program for people with dementia. It is currently not operating because of COVID-19, but we will open again one day, just like with our education department, which Holly and I are a part of. We'll hopefully one day really soon be having classes in person again. That is something unique to the West Center. It is part of our mission to give back. We know that there are families that can come to the West Center, but there are thousands more families that are doing this at home, or maybe doing it from another state, and they just need the skills and the opportunity to talk in a non-judgmental place about what they're going through. And we're able to offer that. And we have an ongoing program list of education that we do in person one day again, but also now online. So we're doing online, and we have videos on our website and blogs just so you can access stuff as you need them. And on there, if you want to sign up for our newsletter, we send it out maybe twice a month about upcoming programs and send you the videos and blogs that we have just to keep you in the loop, but just to keep you educated on caregiving challenges that come up. So talking about, supporting our loved ones in their communities when we can't see them. How incredibly frustrating and at times helpless we can feel, quite honestly, right? So many emotions have just come up, as Donnie's already talked about, just with COVID-19 and the insecurity that we're all put in, where we've been threatened, essentially, our security has. And when we have those feelings, it will affect us physically and psychologically. And these emotions that it triggers, like fear, like anxiety, like depression, can manifest in a lot of different ways and a lot of different behaviors. It can come through anger, sadness, apathy. You name it. It's an expression of what we're going through. And then not being able to see our loved ones that maybe we were seeing every day or seeing on a regular basis can bring on these feelings of helplessness and at times hopelessness. I know that personally for me, Holly and I are working from home now, so we are not going into the center. We can kind of if we need to, but I have a feeling of helplessness because I want to be there to help our residents and help the rest of our staff help our residents. And sometimes it's kind of like, I don't know what to do. And it makes me feel bad, So I can only understand if I had a loved one in a community right now. Just the feelings of, that would just say frustration. And that's an umbrella term for all of this. We do know that right now, there's a lot of information out there about how to cope with COVID, how to, social distancing, quarantine, and all this. And I want to encourage us to really just think, I think we're all grasping for tools. What's the next tool that's going to make me do this better? Or what's the next tool that's going to make me feel better automatically? I kind of feel like we're grasping for these tools. But to encourage us to say, we need to keep it pretty simple right now. We need to kind of master the basics of taking care of ourselves so we can continue to take care of our loved ones and those that are caring for them. And I think the two best ways to support your loved one when you can't be there is for you to stick to a healthy routine. And I'm going to talk more detail about that. But that includes taking care of your whole self. Yeah, we're talking physically. We want to take care and stay safe, right? But the whole self, the emotional, the spiritual, the social, all of it while we're here. So we can provide the support where we're at for our loved ones. And one thing I know is being a caregiver for somebody with a chronic illness or dementia, you guys already have a lot of resiliency. You already have a lot of strength. You already have a lot of skills you've built and developed being a caregiver. So kind of lean back and rely on those skills and take pride in those that you already have and say, this is hard, but I've been through some hard stuff too before through this. And let me, what have I learned through those hard times? And let me just lean back and rely on the skills that I have and take pride in that, in what you've done. Sticking to a healthy routine. And I know you've probably heard this before, a routine is so important. It's so important for our loved ones too, but for us, managing your day and being diligent or disciplined about what you fill your day with, essentially. One of the most important things is to seek reliable sources of information, but limit your exposure to it. we are inundated, especially now, we're just bombarded with emails and cartoons, commercials, and all these electronic messages coming at us through the media, through social media, through TV, all of that. And we really have to be vigilant about which one am I going to pay attention to? Is this reliable or is it not? And I've got to limit, I got to separate myself from this, especially if it's COVID related or the negative or sad stories that are coming out, right? Can you have COVID-free conversations or times where you're not thinking about it? We're not even looking at a screen at all. And this is your phone, your laptop, your iPad, your TV. Let's separate from these screens. And I do know the more exposure that we have is going to cause more anxiety. Just the more it's that we're feeding ourselves with this stuff. So if I already kind of have my anxiety levels already a little bit up, I don't want to keep fueling it with this media exposure. So really limit it. And in your daily schedule, you want to make time for the things that help your whole person wellness. So you want to make time for work, whether that's actual work or it's chores you need to do or it's projects you want to get done. And you need to make time for leisure. This is, you seek out stuff that comforts you and stuff that you enjoy doing. Mm-hmm. And you want to schedule in time for rest and restoration. So it's not necessarily taking a nap, but it's the restoring of your soul. Is it time that you make time to do some meditation or you're out in nature because that is restorative for you? You want to practice a good sleep hygiene. I know that's, personally, it's really hard for me to do that, but I'm going to bed around the same time. I'm getting up around the same time, you know, and I'm getting exercise throughout the day to make me tired so I can sleep better. And then making time for laughter as well. Daily exercise, you know, of course we want to stay physically healthy, and it is about exercise, and encourage you really to get outside while it's nice and get your vitamin D. Being outside can help fight depression, and getting that extra vitamin D can as well. But it's also about movement throughout the day. I know I have been guilty of laying on the couch or sitting behind the desk, the computer all day long, and then I might go out and do a walk for 45 minutes. Well, but I've been sedentary the whole rest of the day. That kind of offsets the benefits of the exercise. So it is get up and move throughout the day, whether it's walking around the neighborhood or it's walking through the house or whatever it is. It's just building that in that healthy routine. And good nutrition is extremely important. One of my favorite quotes is, what you feed yourself, the food that you eat, can be the safest, most powerful form of medicine, or it can be your slowest form of poison. And what we do put into our bodies can help us fight anxiety and depression and fatigue. It also, on the other hand, what you put in your bodies can increase depression and fatigue and anxiety. So being careful about that. And just start small. I mean, if you just start adding more fiber and drinking more water in your day, that's a really good start to good nutrition. Being active physically, but also being active through your mind, body, and your spirit. And that goes back to, are you doing some restoration? Are you doing some spiritual, connecting to your spiritual part of your body? Are you stimulating yourself intellectually as well? But practicing relaxation techniques every day is extremely important. Our stress level is high. I mean, it's up just because of the state of affairs we're in. And we've got to be able to relax our bodies. Our bodies go into a hypervigilant state when we're stressed, and we want to put it back down into our normal kind of baseline. And you can do that through deep breathing, through journaling, through massage. Exercise is a good way to do it, talking to somebody, but it's scheduling this in your daily healthy routine. And knowing that you will have good days and you will have bad days. And that's okay. It's okay to have a bad day, and it's okay to have a good day too. You don't need to feel guilty about having a good day or having a good moment or a good laugh. Reaching out to somebody you trust and making that connection. We do have to be more vigilant. I mean, with social distancing and staying at home, enough stuff is starting to open back up, but people, it's making that connection. Yeah, seeing somebody's great, but it's connecting with somebody. And we can connect over Zoom or over the phone. In person's great, but for right now, you got to make that connection with somebody that you trust. and it's in a safe space, right? And I really encourage support groups, especially as a caregiver. It helps relieve stress. It gives you those stress you can connect with. It helps brainstorming. It helps problem solving. It helps us work through these emotions. It even helps just hearing that I'm not the only one. You know, it's a validating that, oh gosh, somebody else knows how I feel and what I'm going through, and how therapeutic that can be. Right? And Holly runs 2 support groups a week for us, and it's online and it's open to everybody. And she's a counselor, so what better person to run a support group, right? And asking for help. We've got to, I guess, maybe get over ourselves sometimes and ask for help. Right now, you might be maintaining and you're okay, but is it sustainable? Is your patience level sustainable? Is the current energy or the hours you're practicing sustainable? Will you need to ask for help? And this could just be because I'm feeling helpless and I need help to not feel helpless, right? Or to get some ideas. And I'm going to let Holly talk about your feelings here.
All right, thanks, Jamie. So one of the things that's going on right now is you may be feeling some feelings that are not normal to you. And that's okay, because this is not a normal time. But being able to name those feelings means that you can change the feeling if you can name it. So I put on this slide that you can see some of the things that we're hearing most right now during the support groups. So you can see on there, angry, fearful, mad, disappointed, scared, frustrated, insecure, weak, bored, stressed, tired, and it goes on and on and on and on. But what I'm finding in the support groups is so many times that anger's coming up, anger. And as we talk through that anger, it comes down to fear. I'm angry because I'm scared, is what it's coming down to. Being able to say that out loud to somebody means you own it. That's owning your feelings. You're not keeping them bottled up. Another way that you can own a feeling is to write it down when you put that on paper. And then go ahead and feel those feelings. It's okay to be mad. Again, that last bullet point that's on there, it's okay to have feelings that aren't normal for you right now, because this is not a normal time. Okay, if we could go to the next slide. The other thing that I did want to bring up is the sense of grief. And normally when we hear that word grief, we think that about somebody passing away. But actually, grief is just whenever we have lost something. And right now, we've all lost something. We've lost our routines. We've lost our daily life, what we were used to. So we may be feeling a couple of things that we're not used to feeling again. One of those is actually called anticipatory grief. We're grieving what might happen because we don't know. Another one is ambiguous grief, and especially if your loved one is placed, you may be having this ambiguous grief. And the definition of ambiguous grief is a loss that occurs without closure or without understanding. So you may have gone to see your loved one on a Thursday, and on a Friday morning, you got a call that you can't come back. You don't know how long it's going to be until you can come back again. So all of those feelings we talked about that were on that other slide, if you get down to it with the anger and all of that, you can also say that's grief. You're grieving. You're grieving the time that you're losing right now, being with your loved one. If your loved one has dementia, which we know is a progressive disease, and I now haven't been able to see them for 6 weeks, we're 6 weeks further into a progressive disease, and that's time that I've lost. So being able to call that what it is, it's grief. So being able to identify that. Jamie had talked about ways that you could be nice to yourself, but also thinking about ways that you can be nice to other people. Being able to control the things that you can control, because we do feel powerless right now. We feel out of control. But if you'll go to the next slide, the very first thing on that next slide says, you're in control of how much time you spend worrying. You're also in control of how many times a day you choose to smile. You're in control of how many times a day you choose to laugh. Rather than, like Jamie said, sitting in front of the news all day long, have those set times that I'm going to check it in the morning, or I'm going to check it in the afternoon, and then during the day, I'm going to intentionally watch some funny YouTube videos or watch a sitcom that I enjoy, something along those lines. And I am not a fan of the word new normal, because I don't think this is going to be our new normal. This is our temporary normal. So I think it's important to be saying that to yourself also. We can do anything for a little while, and this is a little while in the big scheme of things. This is temporary. It's not your fault. You didn't do anything to make it happen. I didn't do anything to make it happen. This happened. It's also not the community's fault. It's really easy to get mad at the community. They won't let me in to see my loved one. They can't let you in to see your loved one. But keeping in mind, the easiest emotion to have is anger. So we do tend to go to that anger first. And then we've got those hard questions coming up. What if this goes on so long that when I do see my loved one again, they don't recognize me? What am I going to do? How am I going to get back into and become part of their life again when I could be there with them in person? So some of the things that you might be doing right now is doing FaceTime with your loved one, contacting the social worker where your loved one is placed, or the director of nurses, or the ADONs, reaching out and saying, can we arrange FaceTime? Now, sometimes FaceTime to somebody with dementia is scary. They don't understand why there's someone in this phone or this iPad, and I recognize them, but I can't be with them. So what we found is, rather than actually doing FaceTime, sometimes it helps just to have the staff be almost like they're videotaping them, so you can see that they're okay and that they are doing engagements, but they're not necessarily interacting with you, but you can see them. So just keep that in mind, that FaceTime and such as that might be uncomfortable for someone with dementia because they don't understand. Scheduling time, still being the advocate for your loved one, making sure that you are having those times to talk to the nurse or talk to the staff. And then trusting that your facility, your community, and everyone is doing the very best, and supporting them by doing things like, one of the things we have found that is uplifting our staff is personal notes. Family members writing out cards and sending those cards, and then we post them and read them to the staff. There is so much to that. Or sending snacks. We've had an awful lot of people sending snacks, that type of thing. You can also be sending things to your loved one and with a note. So working with your facility, working with the staff, and then of course working with your ombudsman, which is going to segue right into our next speaker.
And I will say really quick, it's the trusting your staff and working with them with the ombudsman in scheduling times to talk to them. Or is it okay, you know I want to talk to the nurse to get an update on my loved one, but maybe you could talk to the management and they can update you. The nursing staff, staffing is just challenging in long-term care, period, and now it's even more challenging. So being able to give them essentially not having to answer the phone all the time, because you're not the only family member, that they're taking care of. So scheduling times and asking those important questions instead of just those nice check-ins are great if they're scheduled, because we want to be able to free up the nursing, the clinical staff to be able to provide the care and do those one-on-one activities with your loved ones. And it's easier when it's scheduled for them, so they can provide better care, if that makes sense. So.
And Jamie, I think along those lines, you will find a lot of communities right now using other, like I'm making family calls right now. Some of our engagement team is making family calls right now so that we can free up nursing time.
And I know we'll go through that pretty quickly. I believe y'all are getting a copy of these slides as well. But we want to make sure that Tina has plenty of time to give you an update. But are there questions that you guys have real quick? I know type them into the chat box and we will get to them.
Jamie and Holly, I do have one question. And the question is, how can a family advocate for a loved one once they've been admitted into the hospital from their living facility during this pandemic?
Advocating for your loved one in the hospital. Did I hear that right?
Yes.
Okay. Thank you. I think, and I'm not as familiar on the rules and restrictions in a hospital, but it is working with the staff there, working with the case manager that you would be assigned. More than likely, you would go through them to be that advocate. I don't know what the visiting rules are in a hospital, but really working with that case manager at the hospital to be that, and making sure that your loved one has what they need in the hospital. The doctors, do they have an updated list on the medications? Do they have kind of those emergency preparedness things? Do they have activities that maybe you could drop off or they could use just to do, your loved one could do one-on-one? Is it a memory box or a photo album that they have that could maybe comfort them? That they could look through and they have that's comforting if you're not able to be there. And the same you would be doing at the community as well, making sure the staff at the hospital knows as much as they can know about that patient, that resident, so they can provide the best care for them. Sending in videos, calling them, it's making sure that the staff has what they need to be able to take care of your loved one. And I would say it's probably going through the case manager would be the best way to do that.
Excellent, thank you.
Donnie, could I just add one thing? I just want to make sure the participants understand in the instructions and email they received this morning, at the bottom, there should be a link that they can use to download all of these slides in PDF format, so they'll have them.
Thank you, Marty. Alrighty, Tina.
I'm up, I guess. Can everybody hear me?
Yes.
Excellent. So first of all, I want to say good morning. Thank you, Marty, Donnie, Jamie, Holly, and a shout out to you, Jamie, because you took my slides and make them so very nice. I do appreciate that. Mine were all kind of dark and blue and she made them all pretty. So thank you, Jamie, for fixing that up for me this morning. So many people don't really know what the Ombudsman program is. There's still so many out there that don't know exactly what our role is in long-term care and assisted living facilities. So this is just a really brief overview of what we do. An Ombudsman advocates for people who live in long-term care and assisted living facilities. Many people who live in long-term care facilities have no visitors. So other than the Ombudsman, that's the only visitor that they do get. We are trained to know the nursing home rules and regulations, and we're a voice for older Texans. Ombudsmen listen to bring the residents' concerns to management, and then we follow up with management until we can try to get some kind of resolution to that problem. For someone living in a nursing home, making a complaint can be very intimidating, and so that's why we're there to try to help make sure those rights are protected on behalf of the resident. So what Jamie has asked me to kind of talk about today was about speaking about the governmental and visitation restrictions and some safety measures and information on PPE. So some of this you might already know, but I think it's important to know where the facility is and what they're responsible to do in reference to this pandemic situation. So according to the governor's report to Open Texas on April 27th, recent reports highlight that the rapid increase of confirmed COVID-19 cases in nursing facilities and assisted living communities in Texas. According to the Health and Human Services, or what we call HHSC, approximately 19% of nursing homes and 3% of assisted living communities have reported positive cases. There are 1,220 nursing facilities in Texas as of April 25th, And as of that date, Texas has 90,689 residents in nursing facilities across the state. The Texas Healthcare Association estimates 150,000 staff work in these facilities across Texas, such as healthcare workers, auxiliary, and other staff. So according to, excuse me, that PDF, Texas Health and Human Services have developed this comprehensive mitigation plan, including recommendations to help prevent the spread of COVID-19 cases in long-term care facilities. And those recommendations set forth in the plan are strategies to help mitigate the further spread of COVID-19. These recommendations are designed to further decrease the risk for spread of infection in the nursing facilities. These recommendations are based on observations of effective and ineffective control methods in the field as this crisis has progressed. And I found this kind of interesting. I wanted you to see, and I know it's not the best quality, but you can find that on the governor's report to Open Texas document. But you can see the staff and the resident positive has increased some, where the total deaths and facilities affected have kind of maintained a plateau. So that, in essence, of that self is good. However, testing positive has obviously is the most increase of the graph. Excuse me. Next slide, please. So there are several recommendations, but for my presentation, recommendation 5 in reference to implementing the enhanced access controls to the facility is kind of what we need to talk about today. And that is, the mitigation plan shall manage and control access to the facility by healthcare partners who frequent the facility and any other individuals providing critical services in the facility. The plan should keep individuals from interacting with both positive and non-positive patients. This should include complete limitations on any unnecessary visitations, enhanced screening and determination techniques, and limited access to the facility through special entrances to control infection. Now, according to CMS, there hasn't been much changes. There were some, and I kind of want to talk a little bit about that. But it still, as facilities should restrict visitation of all visitors and non-essential healthcare personnel, except for certain compassionate care situations such as end-of-life situations. In those cases, visitors will be limited to specific room only. Facilities are expected to notify potential visitors to defer visitation until further notice through signage, calls, letters, and that kind of thing. Note, if state implements actions that exceed CMS requirements, such as a ban on all visitation through a governor's executive order, a facility would not be out of compliance with CMS requirements. There are some exceptions to the restrictions that I wanted to talk about today. In reference to healthcare workers, facilities should follow CDC guidelines for restricting access healthcare workers, and I provided that link right there. Also, this applies to other healthcare workers such as hospice workers, EMS personnel, or dialysis technicians that provide care to residents. They should be permitted to come into the facility as long as they meet the CDC guidelines for healthcare workers. In reference to surveyors with HHSC, CMS and state survey agencies are constantly evaluating their surveyors to ensure they don't pose a transmission risk when entering a facility. For example, surveyors may have been in a facility with a COVID-19 case in the previous 14 days, but because they were wearing PPE, personal protective equipment, effectively, per the CDC guidelines, they pose a low risk to transmission in the next facility and must be allowed to enter. However, there are circumstances under which surveyors should still not enter, such as if they have a fever. There are some additional guidance with this. Cancel communal dining in all group activities, as Jamie and Holly were alluding to, such as internal or external group activities. Implement active screening of residents and staff for fever and respiratory symptoms. Remind residents to practice social distancing and perform frequent hand hygiene. And with the type of residents we have in some of our long-term care facilities, we know this has been a great challenge. Screen all staff at the beginning of their shift for fever and respiratory symptoms. actively take their temperature and document absence of shortness of breath, new or change in cough or sore throat. And if they are ill, have them put on a face mask to self-isolate at home. Next slide, please. For individuals allowed in the facility, such as end-of-life situations, provide instruction before visitors enter the facility and resident rooms on hand, hygiene, limiting surface touched, and use of PPE according to current facility policy while in the resident's room. Individuals with fevers, other symptoms of COVID-19, or unable to demonstrate proper use of infection control techniques should be restricted. And I do want to say that the new information is in black while the older information is blue for clarity, if you're wondering why there's different colors in reference to the text. Facilities should communicate through multiple means to inform individuals and non-essential healthcare personnel of the visitation restrictions such through signage at entrances, exit letters, emails, phone calls, and recorded messages for receiving calls. And Jamie had talked about that earlier. Real imperative to keep those open lines of communication. Facilities should identify staff that work at multiple facilities. And this has been an issue going on where the governor has stated that he's trying to keep, if you've got a particular staff person, to kind of not let them work at other facilities. But when you're talking about agency staff or regional corporate staff that go to different facilities, here's where you would really need to make sure you're actively screening and restricting them appropriately to ensure that they do not place individuals and facilities at risk for COVID-19. I know this is long-winded, but this is old information, so most of you may know it, but it is worth repeating so that we have, general knowledge. Facilities should review and revise how they interact with vendors, receiving supplies, agency staff, EMS personnel and equipment, transportation providers. So when taking residents out, like to off-site doctor's appointments, and other non-healthcare providers such as food delivery, and take necessary actions to prevent any potential transmission. Have them dropped off at a dedicated location like a loading dock. Facilities can allow entry of these visitors if needed, of course, as long as they are following the appropriate CDC guidelines for transmission-based precautions. And in lieu of visits, facilities should consider these options: offering alternative means of communication, which we've talked about already, creating increasing listserv communications to update facilities, such as advising not to visit or any changes that are going on in the building, assigning staff as primary contact to families for inbound calls. I can speak for some of my staff that we've had a hard time getting in contact with facilities because they're not answering the phone and the phone rings and rings and rings. So that has been an issue of keeping up with communication with the facility, or making a call and trying to contact their loved one. So you want to make sure that there's those contacts that the facilities can make sure that the families have to make contact with their loved one. Offering a phone line with voice recording, updating at set times with facilities in general operation status, such as when it's safe to resume visits. So sometimes they'll use their social media or their Facebook page to give information to families. When visitation is necessary or allowable in end-of-life scenarios, facilities should make efforts to allow a safe visitation for residents and their loved ones. So for example, suggest refraining from physical contact with residents and others while in the facility. Practice social distance with no handshaking or hugging and remaining 6 feet apart. And if possible, pending of course on the facility design, create dedicated visiting areas like clean rooms near the entrance to the facility where residents can meet with visitors in a sanitized environment. Facilities should disinfect the rooms after resident-visitor meeting. Residents still have the right to access to their ombudsman program. And of course, this is close to my heart since I am an ombudsman, but there should be access and it should be restricted per the guidance above, except for compassionate care situations. However, facilities may review this on a case-by-case basis. And of course, if that's the case, we are to go through our state ombudsman, Patty Ducaille. If in person, access is not available due to infection control concerns, facilities need to facilitate resident communication by phone or other format so that the residents can communicate with their ombudsman. Advise visitors and any individuals who enter the facility, such as hospice staff, to monitor for signs and symptoms of respiratory infection for at least 14 days after exiting the facility. And if they have symptoms, they need to isolate at home, contact their healthcare provider, and immediately notify the facility of the date they were in the facility and individuals they were in contact with, and the locations within the facility that they did in fact visit. Facilities should immediately screen the individuals of reported contact and take all necessary actions based on those findings. According to the CDC, to prevent the spread of COVID-19, these are the actions that are suggested to take now. And again, canceling the community activities, enforce social distancing among residents, and again, we know and understand that this is a huge challenge. Ensure all residents wear a cloth face covering for source control when they leave their room or are around others, including when they leave the facility for essential medical appointments. Ensure all the healthcare providers wear a face mask or cloth face covering and source control while in the facility. Cloth face coverings are not considered personal protective equipment because their capability to protect healthcare personnel is unknown at this time. Cloth face coverings should not be worn instead of a respirator or face mask if more source control is required. And we've had so many webinars, and so everybody wants to make sure they're doing the right thing in reference to these face masks. And we've been told cloth is better than nothing, but we do want to make sure that the facilities are following the CDC guidelines. If COVID-19 is identified in the facility, restrict all residents to their rooms and have their healthcare provider wear all recommended PPE for care of all residents regardless of symptoms on the affected unit or facility-wide depending on the situation. This includes an N95 or higher level respirator or face mask if a respirator is not available, eye protection gloves and gown. Healthcare providers should be trained on PPE using, including putting it off and taking it off. This approach is recommended because of the high risk of unrecognized infection among residents. Recent experience suggests that a substantial proportion of residents could have COVID-19 without reporting symptoms or before symptoms even develop. When a case is identified, public health can help inform decisions about testing asymptomatic residents on the unit or in the facility. And I believe this is my last slide, but the FEMA for COVID-19 response, we've got the facilities getting PPE packages for nursing home, which is a great thing. They're totaling a 14-day supply for personal protective equipment to over 15,000 Medicaid and Medicare certified nursing homes across the nation. And this will serve that bridge between other PPE shipments, because there's a lot from what we are hearing, scams that these facilities are suffering from, where they're trying to get supplies in and they've been scammed by some providers. Each nursing home will receive 2 shipments with a total of 14-day supply. The first one is going to be done in the first week of May, and the second shipment for a 7-day supply will be the beginning of June. The first shipments will focus, of course, on those with priority hotspots to expand the facilities across the 50 states, District of Columbia, Puerto Rico, and Guam. I know that was a lot of information, but again, I provided you the sources and the links if you want to go into further of those mitigation circumstances and information that the governor has provided. Thank you, guys.
Thank you, Tina. I have a question for Jamie and Holly. Tina talked about the CMS recommendations and talked about the recommendation to stop communal dining and activities. Your administrative staff did a webinar for facilities last week, and they talked about how you all have successfully done group activities and allowed folks to dine in a congregate setting. So I just wanted to make a comment that those recommendations are not necessarily binding. And Jamie and Holly, I don't want to steal your thunder, but I believe your administrator shared that regulatory was out and kind of took a look at what you guys were doing and did not have any concerns. So can you talk a little bit about what you've done and how you can make sure that that those, you know, if there is greater flexibility, that that's not causing any harm?
Yes, and we are extremely likely to have the clinical leadership that we have at the West Center. We are, I mean, all of our residents have a dementia diagnosis of some sort. And while we are trying, I mean, we want to keep our residents safe. I mean, that's first of utmost importance. But we're also still feeding the whole person, right? The social wellness, emotional wellness, mental wellness, all of that. So our like dining program, yes, we ask them, do you want to eat in your room? And if they don't, we encourage them to eat in their room to meet those recommendations to keep them safe. But if they don't, I mean, some people just aren't going to. They want to eat at the kitchen table, right? So we have set up the environment to where it's 6 feet apart. So they're not triggered to go sit right next to somebody else. So there's only 2 chairs at one table, and the environment is set up to where it encourages social distancing for that. And we do encourage our residents throughout the day to wear a mask. Some of them will do it along with the staff, and some of them won't. We just record that into the files. For activities, and this is important, I was going to say this, for our community, but for all communities, making sure the staff knows your loved one. Because we are encouraging more one-on-one activities instead of the big group activities, which we really can't do in a safe manner all the time, unless you have the environment set up to do so. Or you have the residents in their doorways and you can do activities through down the hallway. Like if it's kickball, for instance, you might be able to kick the ball to and from your neighbor, but it's not your hands because you're not getting contact in your hands, right? So just modifying the activities that way. But just encouraging the residents to follow our recommendations as well. But also understanding that we want to meet their whole person wellness too, if that makes sense and answers your question. Holly, do you have anything else to add?
Thinking one of the things that we did, and this also is ways that you can help your community, is we created an Amazon shopping list because families were just saying, what can we do to help? We want to help, we want to help. So I went on and created an Amazon shopping list, and I listed on that a lot of things that can be done, like if someone's in their room. And there's a sensory type and tactile type, the sensory mats and the fidget blankets and those type things. And I put those on that list, and the families go on and they purchase them and they're shipped straight to us. So nobody had to even leave the house, and just kind of coming up with and creating more things that the residents can do individually. But then also the group activities, like Jamie was saying, we've just taken things that we were already doing and we're accommodating, being able to stay just like normally we would be using the balloon and maybe doing like a volleyball with it with our hands, and now we're using a ball and we're kicking it with our feet. So trying to thinking outside of the box is really part of it.
What are you seeing? Have most facilities suspended all of their group dining and activities?
Are you asking us, or Tina may have the answer to that?
Yeah, Tina, what are you seeing? Have most facilities suspended their group dining and activities?
I'm so sorry, I have myself on mute. Yes, most of our facilities are doing it, and if they are doing it, kind of like what Jamie was talking about, maybe 1 to 2 at a table, 6 feet. I've heard that some, just to help reduce anxiety, are doing some dining, but it's very spread out. Those that have the most anxiety, that kind of thing. But yes, it's not totally 100%, but trying to keep some sense of normal. Yes, ma'am.
And Tina, if you could keep yourself unmuted, I have a really detailed question. I think you're probably the most likely
Is
person.
this the one on the,
State-supported living centers? And
no,
your question is, are they categorized as nursing homes?
they are not. We have
Okay,
no.
that's
we have
what
no-
I
Yeah,
assumed.
we have no jurisdiction over those. This is, well, as you kind of said in my introduction, this is kind of a facility that's kind of close to my heart in reference to ombudsman services, which again, I don't have jurisdiction over, but that they need to keep in close communications with HHSC on guidelines for them.
Okay, yeah, because the question is, you know, nursing homes are required to report confirmed and suspected cases, but state-supported living centers are not. And the question is, you know, why aren't they subject to the same requirements? But I think the answer is that they are not considered as nursing facilities and are not subject to the same requirements.
That is correct.
Okay. I do have a couple of other questions in the chat function. This next one is for Jamie, and she has already responded to this, but I think all of the participants or several participants may have interest. And the question or request, I would love the information to get my clients on the support group online. So Jamie or Holly, can you talk about where folks can be added to the distribution list and get more information about support groups that you all are doing?
Yeah, we do, or Holly facilitates the support group every Wednesday at 1 o'clock and every Friday at 11 a.m. And if you just email us at caregiver@jameslwest.org, we'll make sure that you get on that list and you get the links to join those support groups.
I have another question for any of the panelists. My parents' facilities are limiting home health companies to 1 per facility. Does this follow CDC guidelines? So as I understand the question, the residents are not being given a choice of home health agencies. And I hope I'm understanding that correctly.
Is that under the chat, Donnie, or is it under the Q&A? Okay, there it is. So if I can answer that, this is a great opportunity to speak with your ombudsman so that we can help get understanding of what's going on, speaking with the facility. And on my cover page, it's got our 800-272-3921 number. Somebody will answer the phone. You can talk about what county your loved one is in, and we can make sure you get to the right ombudsman. We don't serve Tarrant or Dallas. They have their own ombudsman program, but we would be more than happy to assist in getting that taken care of. I mean, things don't change about having the opportunity for choice, but they're, again, following those CDC requirements, we would just want to get information from this facility and kind of find out what's going on. So that's a good opportunity to use the ombudsman program.
Super. And then I have a comment, not necessarily a question, but one of the participants is with the Dallas Area Rape Crisis Center, and just wanted folks to know that her agency does provide free counseling to folks who've been sexually abused, as well as their loved ones. That agency is available at 972-641-7273. All right. So feel free to submit a question either through the question and answer or the chat function. And we'll give you just a minute or two to do that. And Jamie, can you talk a little bit about charges for the community education and support that you all do?
Yes, thank you. We, for families, we do not charge for any of our education. It is part of our charitable gift back to the community. The West Center is a nonprofit, so we offer all of our programs for free.
Fantastic. And Jamie, do you all restrict any of those education services to either family members of your residents or Tarrant County residents?
No, thank you. Great question. No, we are open to everybody that might benefit from it, wherever you may be. And you never have to step foot into the West Center to take part of our education services.
All righty. The next question is for Holly. Where can we find the Amazon list that you talked about?
I actually created that Amazon list specific for the James L. West families. And I went on, and because also we're putting together care packages for our staff. So they're working 12-hour days and then having to go home and decide what's for dinner. So we're putting together care packages of pastas, you know, just easy things to make. So I created that. So it's specific to us, but if it is somebody who wants to contribute to that, then I can send the link for it.
All righty. Next question, just clarifying that state-supported living centers are not in the same category as nursing homes. And the participant is wanting to know where she can find out why it's not classified as a nursing home and what the differences between the two are.
They can go to the HHS website. They still oversee those buildings, and they can get information about those state-supported living centers on the website.
Okay. And what we might be able to do is work with Marty to get a link to that information, and perhaps Marty can share that with the requester and or others.
That would be great.
I can make a link for that and send it out later today or tomorrow morning. If you guys will just give me that information, that would be great.
Super. The next question is for Jane and Holly. And the presenter or the participant asks, have you all collaborated with an occupational therapist on patient activities, design, or environmental modifications and so on?
Our administrator is an occupational therapist. So she has played a big part into, especially the environmental modifications and the activities as well. And we are very lucky to just have experienced and skilled life engagement staff already, and of course our nursing and clinical teams. We do contract with a rehab company that we work with through physical and occupational and speech therapy for our residents also. But for COVID-19, I believe we're working in-house with just the experience we have, and it's worked out pretty well so far.
We also have a music therapist on staff, and so we have, I actually had the music therapist give me a list of items that she wanted that I added to our Amazon shopping list, things that we've got a lot of individual CD players that we put in rooms. We've downloaded music onto iPads or iPods for residents. And so the music therapist really worked with me on creating that list. So she was also part of it as well.
Fantastic. And I know we're at 11 o'clock, actually 11:01, but I have two last questions I'd like to ask very, very quickly. The first one, are there different protocols for handling a staff member who tests positive for COVID versus a resident who tests positive?
I believe from my last, and this might have changed, but I believe if a staff member tests positive and they are asymptomatic, then they still can work with a resident that's tested positive. If they are symptomatic, then they would go through the 14-day isolation and all that. For a resident, yes, we would isolate them. A resident to test positive, we would isolate them from the other residents for safety measures, yeah.
That's what I understand as well. Mm-hmm.
Yeah. And then last question, Marty, could you just remind us how we get a copy of the PowerPoint?
Yes, the PowerPoint, you can send me an email if you can't find it, but all of you should, in your instructions for the seminar today, at the very bottom, you should have had, there should be a link to download the PowerPoint in PDF format. And then additionally, we are recording this. And so if you have somebody else that you want to listen to it, we will have a link for the recording on Monday. So if you'd like us to send you that link, just please send me a request for that. And when that's ready, we'll send that back out to you.
Super. So I'd like to make one final remark. Next week, Tuesday, which is the 12th, there will be another webinar, which is targeting long-term care facilities, more staff than family members, but family members are welcome too. And a panel of experts, including Bailey Hillman, who is the administrator of James L. West, the state long-term care ombudsman, Patty Ducaye, somebody with long-term care regulatory, somebody from the health department. Will be talking about kind of current and future care issues related to COVID-19. So again, that's going to be next Tuesday, May 12th, and it will be starting at 1 o'clock in the afternoon. So Marty, we might ask for your help in sharing information about that event if you haven't done so already. So
Sure.
Thank you all very much. Our panelists, Jamie Cobb, Holly Glover, Tina Ryder, and thank you all who listened in on today's program. We very much appreciate your time. And that concludes the webinar.
Thank you.
Thank you.
Thank you all. Thank you so very much.